Hello, everyone. I'm so excited to be here today. My name is Dr. Asahi Hoque. I am a first-year gastroenterology fellow at NYU-Langone, Long Island. So today we're going to be talking about food availability and liver disease. First, I want to establish this as a problem. Food insecurity is not having enough food or being unsure of where you will get nutritious food. This affects over 35 million Americans yearly. That's almost 1 out of every 6 people in the United States. So it's a huge problem and one we do not talk enough about. Part of the problem is getting access to food. Food might be too far, which is also called a food desert, and we separate that into 1 mile in urban areas and 10 miles in rural areas. The reason why distance is important is because you may have a grocery store in your city or town, but be unable to get to it. And that is the case for almost 20% of the United States. And 2.1 million Americans additionally live in food deserts and don't even have a car or public transportation to get any kind of food. Specific factors might make someone more at risk. For instance, Black families are twice as likely to be food insecure compared to white families. One factor contributing to this is how our neighborhoods are built. Neighborhoods that are mostly Black are twice as likely to not have a supermarket compared to white neighborhoods. And in New York City, 1/3 majority Black districts don't have walking or subway access to supermarkets. Next, socioeconomic status, which is related to education, disability, access to housing and healthcare, and other things. These all can influence being able to afford food. We can see that in neighborhoods where there are designer grocery stores that are built, soon affordable supermarkets leaving low-income families being unable to afford food. Low-income zip codes have 30% more convenience stores, which likely do not carry healthy items like fruit and vegetables. And urban residents that rely on nearby stores for groceries can pay almost 40% more for the same products compared to at supermarkets. Socioeconomic status, food deserts, food insecurities ultimately leads to eating food that is cheaper and processed, like fast foods, canned foods, frozen foods with increased sugars, fats, and calories, which ultimately leads to high cholesterol, high sugar, obesity, leading to diseases like diabetes, heart disease, and liver disease. In the United States, food insecurity leads to $53 billion in healthcare costs from medical problems it leads to. So let's talk a little bit more about liver disease specifically. MASLD, which is also the short term for metabolic dysfunction associated steatosis, liver disease. It's a mouthful, but steatosis really just stands for fat. This is the most common cause of liver disease in the US. And this is why food insecurity is so important to recognize, because the things that it leads to, high cholesterol, high sugars, diabetes, obesity, that can all lead to this disease. The normal liver does not have a lot of fat in it. So when you get these conditions, it causes fat to be stored in the liver. So it'll go from being this nice brown to then steatotic, so increased fat. That causes inflammation and scarring. That can eventually lead to fibrosis, which is permanent scarring, leading to your liver not working well and developing end-stage liver disease, also called cirrhosis. And that causes the risk of bleeding, tiredness, confusion, infection, and also an increased risk of liver cancer. Luckily, there's been some evidence with weight loss that this can be reversed. Patients at these earlier stages do not typically have symptoms. Sometimes liver changes can actually be found accidentally on imaging, and then other tests need to be done from lab tests to rule out what actually caused the liver disease. And then also lab tests can show if there's any inflammation in the liver. And then fibroscans, which is a special kind of ultrasound, can see how stiff your liver is. And it might be sometimes necessary to take a small piece of your liver to determine what caused liver disease or how inflamed it is. So what's next? First, it's important to determine if you're at risk of food insecurity with a simple questionnaire. If you answer either B or C to this question, you're at higher risk of food insecurity and MASLD. So you should talk to your doctor. And what can you do? You can get screened for the conditions that cause MASLD. So diabetes, high cholesterol, high blood pressure, and getting appropriately screened and treated for these conditions is an important part of preventing MASLD. Losing weight can decrease the risk of MASLD and reverse the fatty changes of the liver. And you can do that through moderate exercise for 30 minutes up to 3 times a week. And then being mindful of your diet, in particular, the Mediterranean diet has been shown to be very beneficial in reducing cholesterol levels, blood pressures, and contributing to weight loss. I've left right here at the end, I've left some QR codes with some information I've gathered with good readability that you can get access on terms of what Mediterranean diet is and what that can look like for you. And if you are concerned about food insecurity and want help with better access to food, in addition to talk to your doctor, here this QR code will help lead you to some applications as well as information on food assistance programs. But please talk to your doctor about diet and helping with food access. And thank you so much for